Welcome to today's informative session on everything you need to know about pregnancy tests. In this video, we'll cover essential aspects of pregnancy tests, including when to take them, how they work, and what different results may mean. Importance of timing. One of the first questions that arises is when to take a pregnancy test. The best time for accurate results is in the morning when your urine is most concentrated. This concentration helps to ensure that the test can detect the hormone HCG, which is produced during pregnancy. Morning testing minimizes the risk of a false negative result, where the test may not detect a pregnancy that does exist. However, if you have a strong urge to test later in the day, it's recommended to hold off on fluids for a few hours before taking the test to enhance the concentration of HCG in your urine. Early testing. You might wonder if it's possible to take a pregnancy test before you've even missed your period. Some tests claim to offer early detection, a few days before your expected period. These tests are designed to detect lower levels of HCG, but they come with varying levels of accuracy. It's important to understand that while early testing can provide exciting early results, waiting until the day of your expected period or a few days after can provide more reliable outcomes. This is because HCG levels increase rapidly in early pregnancy, and waiting a bit longer helps ensure an accurate result. Faint lines. A common scenario when taking a pregnancy test is seeing a faint line in the result window. Faint lines can be confusing and may lead to uncertainty. In most cases, a faint line indicates the presence of HCG in your system, suggesting a potential pregnancy. However, it's important to note that the darkness of the line doesn't necessarily correlate with the strength of the pregnancy. Factors like the concentration of HCG in your urine can influence the line's intensity. If you see a faint line, it's recommended to retest after a couple of days to observe if the line darkens, indicating increasing HCG levels. Understanding line progression. If you've taken multiple tests over several days, you might notice that the test line gets darker with each test. This is due to the rising levels of HCG in your body during early pregnancy. A darker line doesn't indicate a stronger pregnancy, it simply reflects the increasing concentration of the hormone. Tracking line progression can be a helpful way to confirm that your pregnancy is developing as expected. However, if you're concerned about the progression, consult a healthcare professional for guidance. Blue dye tests. When it comes to pregnancy tests, you'll often encounter two main types, blue dye and red dye tests. An example of a popular blue dye test is the clear blue pregnancy test. Blue dye tests display results using a blue-colored indicator line. While they're easily available and cost-effective, they have a reputation for being more prone to evaporation lines. Evaporation lines are lines that appear after the test has dried, sometimes causing confusion and false positives. It's recommended to interpret the results within the designated time frame and to be cautious when using blue dye tests. Red dye tests. Red dye tests, on the other hand, use a pink or red-colored indicator line. These tests are generally considered more reliable and less prone to evaporation lines. The color contrast between the control line and the test line is often easier to interpret, reducing the chances of misreading the results. Use a timer. When waiting for your test results, use a timer as indicated in the instructions. Reading the results outside the recommended time frame can lead to misinterpretation. Congratulations! You're now well equipped with comprehensive knowledge about pregnancy tests. Remember, patience is key, and accuracy comes from following instructions, testing at the right time, and interpreting results within the designated time frame. If you receive a positive result, consider scheduling an appointment with a healthcare provider to confirm the pregnancy and receive guidance on prenatal care. On the other hand, if your results are negative but you suspect you might be pregnant, wait a few days and retest or consult a medical professional for advice. Thank you for joining us in this informative journey. Leave your opinion in the comments section. Don't forget to like, share, and subscribe so you don't miss an upload and you can enjoy the excellent content I send your way.